welcome to Cure. I'm Seema Kumar. I'm the Chief Executive Officer of Cure. I hope you are enjoying this beautiful space here, and we hope you come back every Tuesday to our Tuesday talks, and get a drink, get some munchies to eat, but also we leave you here with a lot of food for thought. So Tuesday talks is our weekly conversation about things that are top of mind for people, and a Cure, just a word about Cure, and then I'll introduce Mary and we'll get started. So what is Cure? Cure is an innovation campus. We're here to really do one thing, and that is to cure, period. And that's why you see the period right besides our logo. And really, it's to advance healthcare. We can't do it alone. No one single organization or person can do it alone. And not even a village. It takes a village, they say, but it really takes an ecosystem. And our goal here is to bring the community here in New York together, but then well beyond New York, globally, to really create a thriving ecosystem that helps us find cures. So that's the goal. And today we have the pleasure of having with us Mary Woolley, who is the president and CEO of Research America. Mary, how long have we known each other? Gosh, forever.
Forever, over 20 years.
Over 20 years, yes, exactly. And so and every time I see Mary, I learn something new. And today we're going to learn something new. I have no doubt about that. And Mary, you've been CEO of Research America for what? Since 1990, right?
Right.
And what a wonderful, wonderful, thing Research America has done under your leadership in terms of advocacy and funding for research, and making sure that America stays at the top of the game, and pushing advocacy as a means to do that. But before that, you were a fellow of the American Association for the Advancement of Science, another organization that we both have been involved in. You serve on the National Academy of Sciences Board on Higher Education and Workforce, and then you served on the Board of Life Sciences before that, and you're the founding member of the Whitehead Institute for Biomedical Research, right? Your Board of Associates, and another place where we knew each other. I worked at the Whitehead Institute, and you were on the board. And then you're, of course, an elected member of the National Academy of Medicine and served 2 terms on its governing council. You're former CEO of the Medical Research Institute of San Francisco, and you have a 30-year publication history on science advocacy and related topics. And science advocacy and trust is something that you and I have always connected on. So first of all, we think everybody knows about Research America, and everybody should, but you never know. So tell us about Research America. What's it all about?
Be delighted to. And first of all, Seema, thank you for having me here at Cure as your guest. It's a remarkable place, and just an engine of innovation. So Research America is a nonprofit, nonpartisan alliance, mouthful, of institutions that are drawn from academia, industry, patient groups, and scientific and clinical societies, as well as philanthropy and individuals, who are all dedicated to making research for health and science broadly a much higher priority in this nation. And we actually have international partners as well in other countries working to do the same in their own nation, because it is important to us that everybody internationally works together as much as we possibly can. We want the US to stay competitive at the highest levels possible, to be sure. But Research America brings together our members and others who are interested to speak with one voice to the people who are making the decisions that will determine the future pace, if not the actual future, of research and technology in this nation. And that includes elected officials, elected and appointed officials, who make a lot of decisions, whether we like them or not, about dollars and policy. So that is our audience, and we're located in Washington, D.C. for that very reason. But our work is national and occasionally international. And it involves that word that you used, Seema, advocacy. And advocacy means making the case for. And advocacy is critical to change, to leadership, to excitement, to opening the doors for science and technology so that it has every chance to thrive and not be held down by inability to find funding or by the inability to work in a network of rules and regulations that are holding people back, stifling entrepreneurship and so forth. So that's kind of our sweet spot, the nexus of science and policy and politics.
So you've been at the helm of Research America for 30 years. So how did you get involved originally, and some key moments during your tenure that stand out for you?
Okay. Well, I was, and you mentioned it in my bio, before Research America, I was the CEO of a independent research institute in San Francisco. And one of the people I met in the course of my time there was Jack Whitehead, another name
Yes.
already mentioned, who had by then founded the Whitehead Institute at MIT. And he was someone who taught me quite a lot about how to be a leader at an independent research institute, especially how to do it without being a billionaire.
Yes.
I always thought Jack had an
Jack
edge
had
on
it,
that.
yes.
But after he established the Whitehead Institute, and it got underway under the leadership of David Baltimore, he turned to the government sector, if you will, and had the realization, along with a number of other people, that unless the science community did a better job of relating to and advocating with government actors, largely members of Congress, we might be in trouble going forward in science. It might be held back by ill-advised policies and not enough funding. So he started the organization that became Research America. I was a consultant to him at the time and became the second president. So that was my path.
Wow, wonderful. So any highlights during your tenure? Yes.
Okay, so we significantly expanded the organization right from the beginning, including expanding and changing the board. This is International Women's Day is tomorrow. This is International Women's History Month, so I can say that when I came on board, I said we need to have more women on this board, like going from 1 to half. And we did that, and we also diversified the board in other ways. So that's one kind of way that change started happening, and it was important change. Then as we got more and more involved in our mission, we realized that it would be useful in order to make a compelling case to members of Congress and those who influence them, i.e. vote for them, if we knew what the members of the public were thinking and talking about and asking questions about. So we started commissioning public opinion surveys 30 years ago, and we'll show some of the most recent work here later. But the point was not that public opinion surveys were new 30 years ago. What was new is that anyone was asking questions about science and then using that information for reasons of messaging and making the case. And correcting course, too, that also came up.
Yep.
Another thing that we're known for is we had a big campaign starting in the very late 90s to double the budget of the National Institutes of Health over 5 years, and that was successful. Fabulous time. It's not always successful around doubling or even significantly raising dollars for science, any kind of science, but having seen what success looks like, I think it put that taste in the mouth of many people.
Yes.
One other thing we do and are known for is an annual opportunity to honor the people in and around science who are excellent as advocates. And we'll be doing that this year, next week, and I'll say a few words about that later.
So we talked about, one of your big moments, which is doubling the NIH
Yes.
budget, through advocacy. Advocacy had a big role to play. Speaking of NIH budget and federal investments and federal dollars invested in research in science and technology, how do you feel about where we are today? Are you concerned or are you feeling good about it?
Now, I am concerned, and if we could have the first slide, I'll show you why I'm concerned, hardly alone. You can see here, and this data actually only goes to 2019, and this is not our data, Research America, it's from the National Science Board, but extended out even to closer to today, these lines have almost crossed now. The reason I'm concerned about the US is that we've been taking for granted now for far too long, arguably at least a decade, probably longer, that we will continue our prowess. We don't have to be the only game in town, but we want to be a leader. The US wants to be a leader in global R&D. Now, I say we've been taking it for granted. We've also ignored the fact that other nations, and not only China, have taken the pages from our playbook that gave us our success from the time of the Second World War forward by making science and technology a primary force, a driver of innovation and growth, economic growth, growth in better health and well-being, growth of all kinds. You see the quote here, it's from the Chinese president in an address last October. It's not from a US president, but it could have been if that quote were written in the 1950s or even the 40s from the famous Vannevar Bush report.
Wow.
So
wow, yeah.
we have a major challenge. It's time to step up to it. The recent CHIPS and Science Act that was passed last summer was a wake-up call, the fact that we needed it, first of all. And we found out, especially during the worst part of the pandemic, that the supply chain meant that we weren't getting all those microchips into the US as fast as we thought we were, and that we were only, the US, manufacturing 10% of them, and not working all that hard, arguably, on finding out what's next after the microchip on that innovation. So that is changing through the CHIPS and Science Act, but we shouldn't be in catch-up mode all the time. We should be out in front and be able to compete on a level playing field. We don't have to be number one and only number one.
But you would think, Mary, especially after the pandemic and the vaccines and, we're all here, I wouldn't say back to normal, but almost, right? You would think that, okay, this makes sense to invest in science because it was that investment in science post 9/11, on biological warfare that had all of these technologies already on the shelves that we could accelerate quickly. Even though, people think that we did in 1 or 2 years what takes 7 years, it actually was because a lot of that, groundbreaking work had already been done.
It already happened. That's right.
Yeah.
And when you stop doing the fundamental research at a great rate, at the maximum you can possibly accomplish, then downstream you will make a lot of sacrifices. Either that work will be done elsewhere and it will be reduced to practice elsewhere in another country where the US then loses the IP power and the new industries that can be developed. If we could look at the next slide, you can see, now I'm going to show you some of the data from surveys that we commission year in, year out. This is very new data from January this year, that the US population generally, this is a general adult population survey like the ones you see and read about in the media on a regular basis, that 80% roughly say that it's time for the US to step up on higher investment in global health R&D. And by the way, I don't have this slide, but they also believe that we need to do a better job in K-12 science education, K-12, as well as at higher ed. And you can see that this is true because we think about politics a lot. We break things down by political party preference, and you can see this is true across Democrats, Republicans, and independents. And it's not only about China, as I mentioned before.
It's great because I think, regardless of what others are doing, I think, for us to be able to invest in science and technology is important to kind of stay the course, right? So the third thing is you had actually also talked about how it creates jobs, right? So investment in science and technology is actually creating jobs. So it's an investment not just in science and technology, but investment in job creation, right?
And
Yeah.
that's a fact.
Yeah.
It's driven investment in R&D over the last many decades since World War II has created. It's estimated that it's created 50% of the economic value, the entire economic value of the United States, and all the jobs that go with it. There's another slide coming up.
Yeah, but speaking of those slides,
Yeah.
because you release the 2023, because you do this annual
Yes.
polling, right?
Yes.
And each time and over the course of many, many, many years, we see trends, ups and downs, right? So this is fresh data from the January 2023 polling, correct?
Exactly.
So there is like society's attitudes on science and technology. And once again, that's where I was going to as well, which is you would think that with all of what we've been through, that maybe people think that this is a no-brainer, but maybe it's not.
Maybe not. Right. Lots of times people assume things that turn out
to be, yeah.
as you say. So let's look at the next. This is my favorite reason to commission public opinion surveys. So here we have President Lincoln talking about how public sentiment is everything. And if you have public sentiment, nothing can fail, but without it, nothing can succeed. Now, every elected official understands this. There's absolutely no doubt about it. And it's adding this awareness, recognition for the science community that's a big part of why we've always, for a very long time now, commissioned surveys regularly. So if we could look at the next, and now we'll just go through a few little tidbits from the recent survey. You mentioned jobs. Mm-hmm. 8 in 10, and you can see this demonstrated in a different way, Democrat, Republican, and Independent. There are some differences here that are interesting to look at, but overall, it's that same 8 in 10 percentage, which is very, very high, of people who realize that R&D is creating employment opportunities for many people in this country. And that it is a driver that we sometimes forget about, that is the reason for so many jobs.
Yeah.
If we go to the next slide, this goes to the point of having, let's be more sure that our tax dollars are adequately invested in S&D, science and technology. Now, let me just say that research and development in all sectors, but particularly in the health-related sectors, is contributed, invested more by the private sector than it is by the public sector, by the government. More private dollars than government dollars. But they are synergistic in how they work together, with the public sector investing more often in fundamental or basic research, some translational, of course, and some clinical, but then the private sector taking that over when some of it has been de-risked. It's still very risky in the private sector during the development phase, but we need both working together in order to deliver the solutions to what ails us. So focusing here on the taxpayer support, we can see that across party lines, people want more tax dollars spent on science and technology, and they even say, although I don't have this slide with me, that they'll pay more in taxes to themselves for that to happen. So the next slide that we've got, there's also strong bipartisan support for incentivizing the private sector. I talked about the private sector, tax incentives, other kinds of policy incentives. This is even higher percentages, again, across all political party preferences. So the fact that the Congress doesn't always respond, we think is a combination of they got a lot of things on their minds, and a lot of times the science community isn't out there making the case. We're taking things too much for granted. The other one is it is bipartisan support. So things that are very bipartisan don't get a lot of public news attention, don't get the media coverage that sometimes ends up being the driver for the legislation. But that doesn't mean people don't care. So the next slide. We're nearing the end of my slide. Oh, I mentioned STEM education, which I think people are more and more concerned about STEM education at all levels, and we should be. And I was actually surprised that the percentages here were this high across all parties, because it talks about the federal government's role. And we think of education as mostly being a state and local issue and state and local funded. But there is a role for the federal government, and calling more attention to that, I think it might just be time, because we are missing out on millions of very capable people who could be contributing from all walks of life, a very diverse population that we enjoy in this country, but we aren't giving every opportunity to all the people who could have it to get involved in a STEM education. And then the next slide. Now this one's kind of shocking, I think. We've asked this question for years, and it doesn't get any better. What it says overall, even without looking at the names there, is that 3/4, roughly, of the people in this country can't give the name of a living scientist. And then when they try, they have one dead one, Stephen Hawking. And he's been on the list for a long time, since he's now been dead quite a while. But look here who has been named. You won't be surprised to see Tony Fauci, right? Very much in the news. This is the kind of survey questions that's sensitive to what's in the news. But it's more fundamental than that, because there are a lot of scientists in our world.
Yeah.
We all know them, people sitting here or watching, but many people do not. And you can read down on who's here. It's kind of telling also, and this is International Women's Day is tomorrow. There's only one woman on this list, Jane Goodall. She's quite far down there. That's striking, isn't it?
Yep.
It's not because there aren't a lot of spectacular women scientists, but because they're not in the public eye. I think the science community is too invisible of its own, and it's its own doing. Scientists are often trained not to be visible, to leave it to the rare individual, the Carl Sagan perhaps, who's great to be on television, or Neil deGrasse Tyson for that matter. But we really should be doing better than this. And I can also tell you that only 40% of people can tell you where any science is conducted. That is not a hard question.
That's not.
We would think it's not a hard question. So we are too invisible, and Research America is working on that. So if we could take the slides down for a minute, and we'll maybe bring some more.
Bring some more.
Yep.
No, a couple of thoughts on that. So you and I have been on multiple panels, and we can talk about this for probably another hour of how scientists and engagement with the public is an important aspect. That's a responsibility that scientists have, I think, right? And the AAAS Mass Media Fellows is one of those sort of programs where scientists spend 3 months either in Washington, D.C. or in a policy environment, or they spend 3 months in the newsroom or something like that, learning how to communicate in a language, because when you're communicating with the public, if you use too much scientific language, it can be Greek and Latin. The other thing that it reminds me of before we go to the next question is the UN Women did a survey. This was pre-pandemic, but still quite recent, where they asked girls who were kindergarten, first grade, second grade, to name a woman scientist. And first they said, name a scientist. So they came up with Einstein, Newton, and then the third one, sometimes that's as far as they got, or sometimes they got to Marie Curie. So, as you said, these are all, not contemporary scientists, right? So this is just, as you said, it's Women's History Month, and tomorrow's International Women's Day. I mean, what is your sort of the role that you play as an advocacy organization, and you yourself as a woman leader, Mary? What do you think are the messages that we need to be sending about women in science for tomorrow?
We do need to make women scientists more visible. I mean, I was heartened. I was just at the AAAS, American Association for the Advancement of Science annual meeting last weekend, and I heard a talk from the Undersecretary of the Department of Energy, Jerry Richmond, and she reminded us that the top 5 people, leaders at the Department of Energy, which is huge, are women. The top 5. The secretary is former Governor Jennifer Granholm, who's not a scientist. The other 4 top people are women scientists. So things are changing. There are more women in leadership positions as well as in positions in science. There's more young women entering the sciences. And we are always make a point of honoring women scientists this time of year. If we could have the next